Hi, good morning, Jones. My name is Mihiraa. Let's start the warm-up session. Do you have a role model?
Yes, I do. My role model is my mother. I follow many of the things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, organizing skills, a polite and humble manner, and a helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. My name is Harmon Harris. I'm one of the nurses looking after you today. I've come to check on your well-being and also to give you your next dose of antibiotics. Before I do anything, can you tell me how you're feeling right now?
I feel terrible. What do you expect? I've been stuck in this room and nobody listens to a word I say. I don't want any more of those pills. Just leave me alone.
I hear how frustrated you sound, and I want you to know I'm here now to listen properly, not just to give you medication. You've said you feel terrible and that you don't feel heard, and I take that very seriously. I've come to give you this dose of antibiotics because it's a critical part of treating the pneumonia in your lungs, but I also genuinely want to understand what's making things so difficult for you. Mihiraa, before I talk about the medicine, let me explain why refusing treatment can be a real concern. If you don't take the antibiotics, the infection won't clear as it should, and that can delay your recovery significantly. It often means you'd need to stay in hospital much longer, and in some cases, a simple pneumonia can develop into more serious complications, like fluid building up around your lungs, which would make you feel even worse than you do now. So, I'm not just saying this because it's a rule. I'm worried about the extra suffering it could cause you. Can you help me understand what's behind the anger?
Of course I'm in pain. My chest hurts every time I cough, and I told the morning nurse and nothing happened. And yes, I'm afraid. I can barely breathe, and people just rush in and out poking at me. You'd be angry too.
Thank you for being so honest with me, Mihiraa. That must be a dreadful combination of sensations, having sharp chest pain with every cough, and that frightening feeling of struggling to breathe, all while feeling like you're being overlooked. That's not acceptable, and I'm sorry that was your experience. I want to reassure you about the staff here. This entire team, myself included, is completely dedicated to supporting your recovery. We truly want to help you get better and back to your own life. However, when aggression is directed at them, like shouting when they enter, it can create a genuine sense of fear among the staff, even if that's not your intention. We can't provide the warm, focused care you deserve if we're bracing ourselves for conflict. Now, let's find some specific solutions for what you've just told me. First, for that chest pain when you cough, I can speak to the doctor immediately after our chat about getting you some regular pain relief, so you're not suffering needlessly. Second, about feeling rushed, I can make a clear note in your care schedule to ensure staff explain what they're doing before they do it, and spend a few proper minutes with you each time, instead of rushing. And third, I will personally inform the doctor about your feeling of breathlessness and fear, so they can review your condition and explain everything clearly to you. How does that sound as a starting point?
That actually sounds like someone finally gets it. I'd really appreciate something for the pain. I'm just so tired of all this.
I completely understand that deep exhaustion, and I can see how that makes everything harder. Mihiraa, I promise we'll work on these things. Now, to be able to give you that help safely and get you home sooner, I need to emphasize how important it is for us to cooperate with each other. This means avoiding the shouting, because it stops us from communicating and finding solutions as we are now. Instead, please use this call bell right here. If you're in pain, scared, or need something, press it and a nurse will come. We just need you to communicate calmly rather than angrily, so we can quickly understand the problem. Stopping the shouting and the refusal of basic care is the only way forward for your health and everyone's safety. I must also be very clear about the consequences if aggression continues. It creates a situation where staff find it extremely difficult to provide the proper, unhurried treatment you need. For the safety of everyone on the ward, including you, if the verbal aggression escalates, I would be obligated to involve our security team, which isn't a path anyone wants to take. Ultimately, that conflict only prolongs your stress and your physical recovery time, and we all want you to get better and go home.
Okay, I understand. I'll cooperate. I won't shout again, but please don't forget about the pain.
You have my word, I will not forget. I'll speak to the doctor the moment I leave your room. Now, with this new understanding in place and knowing I will sort out that pain relief for you, are you willing to cooperate and give your consent to take this current dose of oral antibiotics now?
All right, Nurse Harris. If you'll really talk to the doctor about the pain, I'll take the tablets.
Thank you for working with me on this, Mihiraa. To summarize what we've discussed, so you're clear, you've shared that unmanaged chest pain and a fear of not being heard have been causing the frustration. We've agreed that refusing antibiotics risks a longer, more complicated illness. I've reassured you that the staff is here to support you, and I've promised to get a pain relief plan from the doctor and note your care preferences. We also agreed that you'll use the call bell and communicate calmly from now on, understanding that continued aggression could lead to security involvement for everyone's safety and would delay your healing. And most importantly, you've consented to this antibiotic dose. Now, I'll go and sort that pain relief right away.